From Central Indiana's number one news source, this is Fox 59 Tonight.
Good evening. Thank you for joining us here on Fox 59 Tonight. I'm Cameron Riddle. Thanks for downloading our new Fox 59 Smart TV app on your Roku, Fire TV, and on your Apple TV. And if you're watching us on YouTube, make sure you hit the subscribe button so you never miss any of the conversations that we have right here at 8 o'clock every night on Fox 59 Tonight, where we talk about what's happening from the White House into your house. And today we focus on what's happening in your house, especially if you are having a baby, if you've had a child, or if you're considering having a child. As somebody who has a 10-month-old, I got to cheat the system because I helped raise my sisters who are now college age. So I remember what it was like when they were babies and fixing bottles and all that thing, all the things. I remember those things. But when I became a dad, you realize there's no playbook, there's no manual. The baby just comes out, you stay at the hospital for a day or two, and if you're a dad, they put you on a very uncomfortable couch, and then 2 days later, they tell you, good luck, get out there. In most cases, in every case, you would hope that it is a success story, but we know that once people leave that hospital, every story is not a success, every story is not easy, and oftentimes people struggle to figure out, one, what are they going to do? How are they going to feed this baby? How are they going to make sure that this baby gets everything it needs, and including doctor's appointments and more, because they don't want to become a statistic of infant mortality when the baby dies. And that is also something that Cradle Indy is fighting every day, infant mortality, especially in a day and age where it seems like that task is getting harder. To tell us more about what they do and the fight ahead of them, Dr. Nicole Carey is here in our studio. Good evening. How are you?
Good evening. I'm well. How are you?
I'm good. I'm so glad you're here. Glad to have your expertise. Like I said, this was something that I was like, all right, baby's here. Let's do this thing. Luckily, we had my wife's family's here, my family's here, so we had plenty of help with our now 10-month-old, but everybody is not so lucky, especially with even knowing where to find resources for help. And that's literally the gap that you guys are trying to fill.
Yeah, one of many of the gaps. And I'll say, as a mom of 5, every pregnancy was different and every baby was different. And I felt prepared and was unprepared every time.
And it's crazy when you're in that doctor's appointment. You realize all the different things they're watching for, how many things can go wrong, and how many things are just not in your control. And, thankfully we walked out always with good news, but that's not the case for everybody. And it starts even then when it starts in pregnancy to figure out, okay, what is the next step? And there's not a lot of places to figure out where to go.
Yeah, it's that, the lack of, a roadmap or a guide, but it's also understanding how everything is connected, because it is about the pregnancy and postpartum right after you have the baby, but so many factors that come long before you ever get pregnant affect how your experience will be in pregnancy and in childbirth.
I feel like this is obviously something we don't talk about enough, and you don't even have to get too deep into the politics to know that we don't talk. Most people don't even think about the issue until they're pregnant, and then you're a couple months in, usually, when you figure that out, and you're like, oh man, I wish I would have known X, Y, and Z.
Yeah, it's one of those things. So pregnancy loss and losing a baby is one of those things that we very rarely talk about in community. I'll share candidly, I lost my first 2 pregnancies early, so they wouldn't have been counted in infant mortality statistics, but learned then that it was an extremely common occurrence for moms to experience. Something I had never had a conversation with anyone else about, didn't know what to do, didn't know where to go for support. And that's just the beginning.
First, let's go to Cradle Indy. What, if you could sum it up into, somebody says, what is Cradle Indy? What do you guys do?
So if I could sum it up in one word, we are a connector. So lots of great folks who have cared about this issue. The infant mortality in Marion County has been an issue for decades.
Mm-hmm.
Decades.
Mm-hmm.
There was an instance in the 80s where Indianapolis was declared the most dangerous place in the United States to have a baby. And so since then, it has been a priority of our health department, of our state in general.
Mm-hmm.
So lots of initiatives. The health department does lots of great things. Every single one of our health systems, the hospitals do things. And there's lots of grassroots community organizations that are trying to put attention towards this effort. But Cradle Indy is looking to connect all of those efforts and mobilizing resources. So how do we best work together to make sure that we are creating the impact that we want to see, instead of, so-and-so is doing work over here and so-and-so is doing work over there, and we're going to focus in this area, y'all focus in this area. How do we work together in order to create one coordinated system for the city of Indianapolis? So, you find out you're pregnant or you're thinking about getting pregnant, you call Cradle Indy. And Cradle Indy can help you connect to all of the different services that you might need and learn and provide somewhat of that roadmap.
Indiana ranks in the bottom 10 of states for infant mortality. What do you think? One that obviously explains why an organization like Cradle Indy is needed, but what do you think when you hear that statistic?
That we have work to do. Indiana also fares extremely low on maternal mortality. So the entire reproductive experience, from bringing life into the world and being pregnant yourself, is a dangerous endeavor. And it is something that we all need to be able to take care of each other. And it's not something, Cameron, that we have to just, a mom needs to figure out what to do. This is a societal issue. This is a community issue. Infant mortality is the number one health indicator for a society. If we have healthy babies, we have a healthy community. If we don't have healthy babies, then we don't have a healthy community.
Is it getting harder in this day and age? You're having one again. You've got a state that already ranks toward the bottom, and then this same state is cutting all kinds of funding. Federal government is cutting funding. Do you see how we're on the track? Are we on a track of improving our state's rank?
Oh, that is a great question. Indiana focuses a lot on economic development and workforce development. And I think that it's really important to recognize the connection between those two things. So if we're not focused on infant mortality, if we're not focused on healthy babies, healthy pregnancies, we end up with lots of preterm birth and babies that are low birth weight, which then affects education, right? We have babies with higher needs, and toddlers, and then school-age kids with higher needs, which is more expensive. And then we have lower productivity in our workforce because of those students, those babies that then had higher needs. And so when you're thinking about attracting folks to come to Indy, we need to be able to show that we have a trajectory of a healthy society. And so investing in health and investing in healthy pregnancies and healthy babies is really the only way I feel that we're going to be able to dig ourselves out of a hole. It can't just be this one focus on economic development or a focus on health or a focus on education. All of those things are connected.
I mean, to be frank about it, I mean, how do you get? We just heard the governor talk about the college programs that IU and these schools have, and how they should be more realistic for the real world. Well, who's going to do those jobs? Who's going to get those? Who's going to make it to IU? How do you focus on making it to IU when we're not even focused on making it to pre-K yet? Where do you start?
You start before pregnancy. It's a whole life course from, we could talk about it with womb to tomb. If you want to solve any issue at any given point, if you're thinking about that one point on the line, you're not going to solve the puzzle. If we're not thinking about the whole picture, then we're really missing the point. And I think That's one of the things I'm excited about. The reason that I am excited to tackle the mission of Cradle is because the biggest part of the mission is connecting. So work that's happening, work that's not happening, identifying the gaps, figuring out how could these two folks work better together? How can these funders who are giving away millions of dollars in hopes of making a dent, making an impact in whatever focus that a grant has, how do the organizations that are receiving those funds work together to make sure that their impact is solid? And that's not something that we as Indianapolis, from my perspective, something that we particularly do well. Other cities have done really well in creating collective impact, coming together, looking out for the cause as opposed to the bottom line. And instead of draining the system, have been able to be more efficient, have been able to lower infant mortality rates, have been able to increase healthy pregnancies, increase breastfeeding, and that in turn lowers cost, lowers the cost that is so high when we have sick babies. The cost to take care of them is extraordinarily high.
I am really worried about people and the resources that they currently have, and they don't realize that are going to go away due to the politics and the funding cuts. And I wonder about an organization like yours. How do you guys survive in a world where you got what you're doing is not being prioritized? So it seems like there's even more weight on you guys to pick up the slack. There's nobody supporting that effort. At least it feels like from over here.
I think that's part of my job, is to build that support. And what I have really noticed is that people are looking to be activated, to be in collaboration. Collaboration sounds like a nice idea, but who's going to do all of the work to make sure that it happens? If you have a small grant to do your work and you have to keep your lights on, you're not going to expend a ton of effort to try to make sure that every other organization around you is doing that work with you and in alignment with you. And so, one, I'll say my job is to make everyone see that bigger picture, but also those that have more funding. So all of our health systems, the hospitals, our Medicaid providers, insurance providers, folks that are making money in this system also have a responsibility. This isn't just public funding that needs to fund this. We need to have funding streams from philanthropy, from private sector, and from the public sector. And that's the only way that this is sustainable.
What response are you getting these days from any of those from those sectors to say, hey, we need you in this as well?
Great.
Good.
I think to much surprise, the health systems thus far, I'll say I'm only a few months into the job, but are really excited about the collaboration. To have a citywide coordinated care system is something that we have never had, and something that I believe the health systems would be really excited to participate in. And so IU Health, Eskenazi, Community, Franciscan, they've all participated in conversations, Ascension, and how do we share the data? How do we measure impact? How do we mobilize our resources? No one has said, no, we're not going to have that conversation. And they've all been showing up to the meetings and showing up in putting their money where their mouth is in supporting Cradle.
Well, now, at the same time that this is airing for the first time, you're having an event where I know a lot of those organizations will be there to support, because you're having an event to show all of these different organizations coming together to confront this issue. What is going to happen on the night of the 16th?
Well, I'm really excited that folks are able to be in one space. And although we've been having conversations for months and months and asking for commitments and figuring out what does partnership look like, not just with the hospitals, but with community grassroots organizations. One of the things at Cradle Indy that we hold very dearly is that the voice of lived experience needs to be a powerful one, needs to be a deciding factor in how we move forward. You only make change in a community if you listen to the community, if you involve the community.
Mm-hmm.
So I'm really excited about tonight. That is the public display of that collaboration. We have a public signing of a signing ceremony where all of these organizations, grassroots organizations and larger organizations, are coming together and saying, we commit to this fight. We are going to fight together.
Mm-hmm.
We are, everybody's their own superhero in their own story, but we need the Avengers at this point. We need everybody to come together, and it's going to be the public display of that.
When was Cradle Indy? How long has it been around for organization? No, you're new to it, but how long has it been around?
It's been around for a while. I think the conversation started in 2019. And then when the pandemic happened, things slowed down, momentum slowed a little bit. And then the past couple years, as the folks have been trying to gain momentum, we've been doing community conversations and strategic planning, because the model that's worked in other cities, that's worked in Cincinnati, that's worked in Baltimore, that was working in St. Louis, those models are all different because they're based on the communities that they serve. And so we had to spend a lot of time making sure that we were on the right track. And what does Indianapolis really need? And it's very complex and complicated to figure out all of the factors that go into fighting infant mortality.
So I know, and I'm reading here, Cradle Indy exists to ensure that every baby born in Marion County has the opportunity to celebrate their first birthday. What does that look like if you're a parent?
You have an extremely important role as a parent. It is you're the front line, right? And so getting as much information as possible. And I know, as a person who is extremely busy and trying to care for my kids and keeping the lights on, I don't have time to call 5 and 6 and 7 different places to find all of the resources that I need. Right. And so Cradle is that place. We're hoping that parents will be able to see everything that they need in Cradle and find the resources the resources that will serve them as best that they need. And not everyone needs the same thing. Different communities need different things. And so the onus is not on the parent to know all of those things, but it is to come. And so parents, but also community members, we all have a responsibility to direct folks to the right places. One of those things that I'm really excited about is doula care. Lots of folks in the community that I've spoken to, because we're going to be providing doula care to families free of charge, is, well, what's a doula and why is that important? And so I would say, as a parent or as a community member, learning those things, finding that education, and then sharing that, share it with a friend, share it with a colleague, because healthy babies, healthy communities, it's on all of us.
When you said doula, my wife's friend wanted to be her doula. We still had the baby at the hospital. And that was, of course, a whole discussion of back and forth for a while. Are we going to have this baby naturally with absolutely no epidural? She tried that for a little bit. And then that pain kicked in and she ended up getting it. And that was also a thing where I was like, man, there's really nothing I can do for you right now but sit here and say you're doing a good job. I'm sorry. But she did have a doula, so she was there to help guide her. But that is also something that I know in communities of people who look like us, that is also something that's not completely somewhere that a lot of people even know about.
Right.
So how much different, or how much, what is the right word? How much additional effort or resources or attention, whichever word you want to choose, needs to be put into moms and babies that are Black and brown?
Well, that is a great question that I think the data answers. If you are Black or brown in Indianapolis, you're more likely to experience adverse outcomes in pregnancy and in childbirth. So maybe attention is not the right word, but it is, the resources should follow the need. And we know that some of our communities that have the highest need have lots of residents that are Black and brown. And so what does it look like to serve the communities in the way that they need it? It looks different. And so for me, and I'll share my experience, having a doula was nothing like what I thought it was going to be. So I had my first 3 kids, and when I do something, I do it well. So I read the books, I watched documentaries, I interviewed OBs, like, what's your cesarean rate? I was very serious about this childbirth situation. And I think I did well. You know, I had my family with me. I had my village of women, my cousins, my sister, my friends. And so I didn't need anything else. So I thought. And then baby 4 comes along in 2020, pandemic. You're not allowed to have your village with you. And I didn't know what to do. And someone recommended having a doula. And I don't really know what that is. Even after all that research, I didn't know what it was. And it was a transformational experience. For anybody, it would be a transformational experience. But for me, it was extremely transformational because when you know the statistics, when you know what the data is, I am always advocating for myself. I'm always on alert. But childbirth is one of the most vulnerable times in your life. You are extremely vulnerable. So when a doctor says, you need this, or you should do this, or a nurse says, you should do this, you just listen because they're doctors and they're nurses. A doula is your advocate that is by your side, a childbirth expert. That is not a person who is a clinician. They're not there to make clinical decisions. They're just there to support you throughout the entire pregnancy. So not just at the birth. And then after. My doula was with us for 6 months after baby number 4 was born. And then again with baby number 5. Advocated for me in a way that I did not know was even possible. And that was something that my family didn't do because they were not trained and they were not experienced in being in childbirth. And so we deserve that. We deserve that level of care and nurturing. And it's, I think, one of those things where women are not always told that they deserve to rest and they deserve to be cared for because we are the nurturers. We are the ones that care. In most cases, yes. And so doula care is not the only solution, but they are a critical piece to the maternal wellness team. And funding doula care is something that we all should care about.
In that first 6 months after the baby is born, seems to me, I was like, all right, this was the hardest part because they can't do anything. Now my man's moving around. He's picking up his own bottle. He refuses to go to sleep, but he's gaining his independence. But in that first 6 months, my mom would come over. My wife's cousin, who's a nurse, would come over. My wife's mom would come over. We had different people coming in to help care for her, help care for the baby. Nobody cared about me.
That's not true.
No, it's not true. It's not true. No, they came and brought dinner and things like that. But that is not, those are not resources or blessings that everybody it has access to, with people helping, just like you had your family around you. And I'm wondering what kind of resources or what kind of help you would be able to give somebody who's saying, I just had a baby, don't have any family here, not really sure. Because not really sure where to go, because sometimes you also don't know what you need, because you're trying to figure out what this baby needs, and he can't 100%. Even talk and tell you. So where could you direct somebody like that?
Yeah. I mean, imagine a mommy who doesn't get maternity leave or paid leave. Imagine a mom who's the sole care provider for their family. You don't have the luxury of resting, right? A lot of moms will take as minimal time off as they possibly can and get right back to work. And so what Cradle does is connect to resources that help with that, and advocating for paid time off, more paid time off, making that more from a policy standpoint, that's something that needs to be considered. But until that time comes, providing postpartum doula care up to a year after a baby is born, that is something that was critically important to me. But imagine just being able to have an extra pair of hands to help you around the house.
Well, that is the fire alarm going off here at Fox 59. And I would suppose that by law, we would have to evacuate. So, I don't know why. I guess we should go. Dr. Nicole Carey, I guess we're going to have to cut it right there and interrupt the show. But we'll come back and we'll have more of this conversation with you. Thank you for all you do. There's more questions that we could keep talking about as far as infant mortality and what moms need. It's a very important part, and it's really a dangerous part of life as well. So thank you for what you do.
Thank you.
All right. More Fox 59 tonight is coming up. We are going to exit the building now because the fire alarm is going off. You're watching Fox 59 tonight.